All right, let's get started. I'll call to order the August 13th, 2020 business meeting. To link to this agenda on, go to www.clackamas.us/meetings/2020-08-13. And with that, I'll ask our illustrious County Administrator, Gary Schmidt, to please take the roll.
Thank you, Chair Bernard. First, our staff support today, Clerk to the Board, Christina Twilliger, County Counsel, Stephen Madkour, additional staff support, Mary Rathke, Dylan Blaylock, Rich Marvin, and Garrett Teague. Roll call, Chair Bernard.
Here.
Commissioner Fisher.
Here.
Commissioner Savas.
Here.
Commissioner Schrader.
Here.
Commissioner Humberston.
Here.
I'm still messing with my screen trying to get it to work right, but see if that works. All right, with that, we are holding this meeting virtually. If you joined us on Zoom app for this meeting and you are interested in providing public comment, we will prompt you regarding how to do that when the time is right. You will have the option of providing your comments to us live. Alternatively, anyone can send a comment to be read during the public communication portion of our meeting over email. Just send it at any time during the meeting by email at clackonews@clackamas.us. That's clackonews@clackamas.us. Be sure to include your name and area where you're from. With that, Pledge of Allegiance. Please join me in a Pledge of Allegiance. I skipped that. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, Gary, what's up first?
First, our COVID-19 updates. We have Nancy Bush, Director of Disaster Management and Incident Commander of our Emergency Operations Center, and Dr. Sarah Present, our Clackamas County Health Officer. Please go ahead, Nancy.
All right, good morning, everyone, and thank you. So we'll start off with our numbers today, as we do every day. The increases I'm going to be talking about are since Monday. So here in Oregon, we have 22,022 positives now, which is up 534, 375 deaths, which is up 18, 440,520 negatives. Clackamas County has 1,595 positives, which is up 22, 47 deaths, which is up 7, and 42,123 negatives. Multnomah County has 5,056 positives, 96 of those are new, 98 deaths, which is up 2, 98,227 negatives. Washington County has 3,202 positives, which is up 83, 27 deaths, which is up 2, and 62,415 negatives. Hospitalization statewide is 162, which is up 10 from Monday. 38 of those are in ICU beds and 14 of those are on vents. Our adult ICU beds available here statewide are 159, and that's out of 744 that are staffed. We do have 763 ventilators available statewide. We did receive our new school metrics, and we're going over those, and Dr. President is going to talk a little bit more about those in a few minutes. And of course, the new metrics are causing quite a few questions that we're trying to field and working with our schools. We did meet with the new Equity, Diversity, and Inclusion Officer here for Clackamas County to discuss ways that her office can help support what is going on here in the EOC and look at the continued support for our liaison section, which is working with our underserved population. So that was a very positive conversation, and we're really looking forward to having that office involved in the Emergency Operations Center. We met with some of the community-based organizations that have contracts with the state to reach out to migrant and seasonal farm workers. And so we can work together, working on to reach that population. We continue to receive quite a few PPE requests from the small businesses here in our county, and we continue to fill those requests as quickly as possible. Our ops team is meeting with new members that are going to be working on the school plans and those reviews. And so we're doing some orientation there. Our PIOs are working too with the regional information system and the county public health and communication plans for vaccinations, because we want to plan now for the vaccination. Those clinics, of course, will be very intense. So we're trying to get ahead of that as well here in the EOC. I also want to just mention too, before we look at our metrics, that the Mosier fire, I don't know if you've read much about that, but the governor did sign a conflagration. We do have the Clackamas Fire Board is sending over a team. And that is pretty important too here when we talk about COVID, because we want to make sure our team members are very safe. As you know, usually they camp, they bunk. Those camps are usually pretty closely set together. So there's a lot of work that has went into that before they actually go over. There are also, I haven't seen a number of homes, but they say several hundred homes that are being evacuated, which also is very challenging when you're trying to put people into shelters during our COVID situation. So I just want to bring that up to let you know that we are involved in that. We've had conversations. It's like, what if we have to do something like this as well? But it's extremely complicated when you're looking at wildland fire and COVID together. So Dylan, if you'll please bring up the metrics for me. Thank you. So the metrics came in last night. So for Clackamas, Multnomah, and Washington, we are missing 3 of the 6 as a region. So the trend of percent of tests that are positive in the last 7 days is at an uptrend. It's 4.5%, which is still under 5%, but it has went up slightly. 41% of the cases not traced to a known source in the last 7 days, which should be 30% or under. And we're at 90% in the region here for cases in the last 7 days with a follow-up within 24 hours. Clackamas County is missing 2 of the 3. So we have an uptrend of, with the person's percent of tests that are positive in the last 7 days. And we are at 33% of cases not traced to a known source. This has went down over the last several weeks. And so as you can see, we're just slightly above that 30% now. If we can take me down to Multnomah County, please. Okay. So Multnomah County, they are also missing 2 of the 3. The 47% of those that cannot be traced to a known source, they're at 84% for the contact within 24 hours, which should be at 95%. And Washington County. All right, thank you. They too have an uptrend here for the percent of tests that are positive in the last 7 days. Again, we'd like to see this number under 5%, so they're slightly above that. They're at 36% for those cases not traced to a known source. And they do have an uptrend here in hospitalizations. So at this time, I'm going to turn it over to Dr. Present to talk a little bit about this, and then she has her own slides as well.
Thank you. Good morning, commissioners. Thank you for having me today. I don't have a whole lot to add to what Nancy just described around our metrics. I think you can see that things are actually trending in a positive or a good direction. You know, when I say positive, it could be positive versus negative anyways. There is a sense of sort of stability in our numbers. I feel like things are, we have not had a significant worsening in the last week. As I said last week to you when I was here, things seemed a little bit better and things have remained somewhat stable. So this could be a flattening out after summer activities and our first reopening. It could be an example of how each step of reopening may look. We always can assume that anytime we have increased interactions with people, we will have increased spread of this disease as long as the disease is in our community. But things are looking okay right now. Our staff in public health are still quite busy. There are lots of workplace notifications, lots of work with employers to control spread of outbreaks within small businesses, within long-term care facilities, and working on trying to support schools in planning. So even though our numbers are stable, our team is still very, very busy working on all the different aspects of this disease. If you bring the metrics back up, please. I do want to note this is fine. The fact that we are very close to the 30% traced to a known case, I think is reassuring, but we always have to keep in mind that 1 week does not totally make a trend. And we really are looking at least 2 to 3 weeks for making any statements about trends. You can see on your screen now, the case counts over the last 2 weeks. You can see that on August 9th, we had a surprisingly low number of cases. I don't have the case numbers in the last few days. And I think that 9 is making our overall weekly metrics lower. And I can't say if that's going to continue or not. I can knock on wood and hope that it does, but I can't, I don't feel confident saying that things are absolutely improving, but things are looking good. So here's our case count over the last 2 weeks, looking very stable. Go to the next slide, please. Sorry, this is a big table, but I wanted to point out the top case per 100,000 rate in yellow. So one of our metrics for schools in the county to be able to open for K-3 or certain individualized on-site learning is to be under 30 per 100,000 for at least 3 weeks in a row. And you can see that in this last week, we met that. I cannot tell you if we are going to meet that next week or not, but we are, again, going in the right direction. We also have here the numbers of household cases versus sporadic. That sporadic is the number of people, the number of cases that we cannot trace to an outbreak or to a known other case. So 42% of people in the last week still, we do not know where they got the disease. Again, this metric is a little bit different than the one that is on the OHA site that we just saw, based on the time frame in which the numbers are pulled. So we're looking at somewhere between 35 to 45% are not traced to a known source, and that is one of our biggest indicators of ongoing community-wide spread. So until that is really well controlled, I can't say that we have good control over the transmission of this disease. As far as unable to reach, we have been able to reach more of the individuals. And then still there are very few people who are refusing to do an interview once we reach them, but there's still a fair number who we are unable to reach. And then we cannot identify where they may have gotten the disease or ensure that we are controlling the spread. I'm going to stop there and see if there are any questions about this. And then I have a couple of slides about the about school reopening metrics.
I don't see any hand. Oh, Sonia.
Thank you. So I am curious, I can't recall when, if it was 2 weeks ago, maybe, you let us know that the testing results were taking quite some time to get back.
Yes.
And I'm curious if that's improved and how long the wait time is now.
Thank you. It is still a significant concern. So the hospital systems that have in-house testing are getting their case, the lab results back to 1 to 3 days. So that is good. It's really still the send out labs going to Quest and going to some of the other non-local labs that are still having significant, excuse the cat, sorry, significant delays. We did have one individual we spoke with yesterday who did not get her test results for 12 days. So I have not heard as much discussion about it as being something that people are concerned about, which And I think that the supply issues are maybe leveling out a little bit, but we still are waiting a significant amount of time for certain labs. The ones who are doing the labs with the in-house labs in our local health systems are coming back in a timely manner.
So do we know about what percentage come back timely and which aren't coming back timely?
I don't. No, I was actually trying to look into that this morning to see if we could find anything for you, and I don't have a better answer other than we know. Yeah, no, I'm sorry, I don't have that.
Okay. I mean, in my thinking, it's very significant, especially as we're looking at kids and schools, and I know that's going to be your next topic. But if the cases are 10 days delayed, or what percentage is delayed, I think is pretty significant. I have another question about the disparities in regards to who is positive. I participated in a Oregon Health Authority presented to the Association of Oregon Counties Health and Human Services Committee and did some statewide numbers that showed dramatically the prevalence of people who are Hispanic being very much disproportionately affected by COVID. Do we have that breakdown for Clackamas County and even for the region? I would be really interested to see the disparity data.
Yeah, we actually do. There's a regional data dashboard that you can access through the Blueprint Clackamas website, and you can filter by county. And there's a race and ethnicity site on that looks at the percentage of positive cases of different races and ethnicities versus their percentage of our population, and you can filter that by county. So yes, the Latinx community does have disproportionately high numbers of cases in our county as well as the region.
Yeah, I was curious if it was the same. I expected that it would be, but I just wanted to verify that. Thank you so much.
You're welcome. And I do want to just mention with that community, we have contracted with Northwest Family Services, and there are other CBOs that we're working with to ensure culturally appropriate and safe outreach to them to help manage needs around this. And those partnerships are going very well at this point.
All right, Paul.
Well, as I commonly reference, you know, there's all different ways of looking at numbers, and we talk about percentages, and we talk to you about the actual numbers, and then we can do averaging. And it seems to me that on the county indicators, there ought to be some metric that looks at it maybe from a 3-week average as far as trending or averaging, and only because my assumption was all along that the county indicators were related to phasing, and the phasing is based on a 3-week period, I thought. And so it seems that it's hard, or gets kind of fuzzy or blurry when we're looking at a 1-week scenario versus what the state might be looking at in a 3-week scenario. So I just want to just kind of put that out there. But my question is that getting back to the testing aspect, are the volume, the number of tests we're doing per day or per week going up or down? It seems to me that that's a factor, and because if our test numbers are going down, that's going to affect the percentage of the results, right? If the numbers are going up, that affects it. So I'm just kind of trying to get a sense of where we are in the number of testing, and let alone the delays. It seems we ought to have a sole page completely dedicated with all that data, because that's just an important part of it. I'm hearing 5-day delays, 10-day delays, and I'm hearing that in Canby, you can get the quickest result if you go to Canby for testing. You get a 24 to 48 hour turnaround. Don't know if that's true, but I'm hearing all different kinds of varying numbers and results as far as testing.
Yeah, so I can tell you the state public health lab monitors their testing capacity and some general testing capacity throughout the state. I have not seen a major change in numbers of tests. There's also a tab on our regional data dashboard that looks at testing, which I can pull up and give you some more information about that right now. And I can tell you back to Commissioner Fisher's question from the State Public Health Lab, in the week of July 22nd, about 30% of the specimens were sent out for testing. I don't have anything more updated, so that's a couple of weeks old. And I think that the testing disparities do put in all sorts of questions around our numbers. We look at the metrics based on the report date, and that report date is based on our lab report. We also look at trends based on the symptom onset date. We have that information, but all of our metrics are based on the case report date. And so if there is a disparity in when we are getting those, that definitely can affect things. And so I completely agree that this 3-week look at the numbers in order to make decisions is much more realistic and accurate than looking at 1 week at a time. I think 1 week at a time, like I said, I don't know if this makes a trend or not. I think 2 weeks is the minimum that we want to look at, and 3 weeks is a good sense to see if we're going up or down, because 3-week period of time is going to collect those cases. What the main issues are then also that we can't get to those cases quickly and ensure that they are isolating and ensure that their contacts know to quarantine. And so, you know, the public health toolbox when we have to wait on a delayed test it's not possible to actually control the disease spread that way.
Yeah. Well, I appreciate that. I think you're pointing out that the 10-day delay, if that test result let's say if it is a 10-day delay on a particular test, that's really something that happened 10 days earlier, but it's being reported 10 days afterwards. Our trending, we're looking at it weekly. So yeah, I concur. Thank you.
Martha.
Okay. I guess my question is this. People are going to their private health clinics for tests, as well as then there's a public component of this. And are the private tests, in my experience, the private tests take at least 10 days or more for whether or not someone's negative or not. And the public tests, who is doing the bulk of the folks that, for example, may be exposed, may be carriers, who don't have access to that same level of private care? Is that a public health function of the state? And is there a difference in time? It doesn't seem to be a difference in time between whether you have a private health, you're doing through your own healthcare system like Providence versus Oregon Health Plan and things of that sort. I mean, it seems, that it's taking a long time.
I think, the pandemic has certainly brought up a lot of things to focus on with the disparities in healthcare access. The health insurance, I believe, has less impact on the testing versus where you go, right? So Oregon Health Plan, if you end up going to the emergency room at any of our hospital systems and go through and get a test that goes to their in-house lab, that's going to come back quicker than if they were to go to, say, potentially Rite Aid or Walgreens that may, or one of our clinics that uses Quest, or one of the national laboratories that is really feeling the strain of the national testing supply issues. So for those so the Oregon State Public Health Lab is our public testing option that is free if you meet criteria. And those are prioritized public health individuals, which most of the work at Oregon State Public Health Lab right now is with our long-term care facilities, sort of large kind of mass testing of long-term care facilities for their initial surveillance or in the setting of an outbreak. Also, in a setting of an outbreak where we want to do testing of everybody, say at an agricultural site, then that could potentially go to the Oregon State Public Health Lab. And then the public health department, we need to manage all of those results. Our FQHCs are working on increasing testing. I do think that our Clackamas County Health Center is getting one of the Abbott Rapid machines. That seems to be, we're in the works of getting the policies and procedures around that, and that should be going online soon, which will give more rapid services for our health centers patients. Other FQHCs in our area are working on trying to find other testing options to make sure that everybody gets the testing that they need. And then that would be a way that we could also refer sort of high-risk contacts from public health to our health systems to ensure that they get testing. So there are a lot of conversations around it, and I can go on and on about that, but I'll stop there. Hope that answers it.
I think that's what I'm trying to discern, that it seems as if there are multiple players in the system, and it doesn't seem as if they're all coordinated for speed and efficiency at this point. I'm not blaming anyone. I'm just saying from my observation, external, it just seems to me that it seems to be fragmented. And you have multiple players doing the testing with no control over the timing. Would that be an accurate statement, or am I missing something? I mean,
I don't think you're missing anything. I think that's fairly accurate. I do want to mention, I pulled up the regional data dashboard that you can link to on Blueprint Clackamas, and we do have testing per week and total number of tests. And it does look like the total number of tests has gone down in the region since the beginning of July. And I'll just encourage you to go to that site and look at details.
thank you.
Yeah.
All right, go ahead with the schools.
Okay.
Dylan,
Okay.
would you bring up the slides again, please, Dylan? So there were some new metrics that came out around school options for in-person learning. I presented the basic metrics last week, which for our county, there's really not a significant change. The main changes that I see in the reopening for in-person guidelines were for smaller, remote, rural counties that,
Yeah, Wheeler.
yeah, when you deal with the numbers in certain ways, it disproportionately affects different communities. So there are not significant changes. Our whole county needs to be at less than 10 per 100,000 for in-person learning. K through 3 could potentially have in-person learning when we're less than 30 per 100,000 over a 3-week period, which, like I said, last week we were, so that could be coming soon. But and our test positivity needs to be less than 5%, which has not been a concern for us in Clackamas County. The state percent positivity of tests also needs to be under 5% for any of the statewide schools to have in-person learning, and we are not there. And so I believe the statewide is around 6 or 7 right now. I don't have that exact number, I'm sorry. Limited in-person instruction for specific groups. This was in the metrics previously. This is really focused on students with disabilities that really need to have some one-on-one in-person interaction to have equitable education. Students with English as a second language or English language learners, and then certain career technical education that requires hands-on skills. So that would be an assumption of a hybrid model and limiting the in-person time to the minimum amount necessary and having significant limitations on cohort sizes, et cetera. And so there are details on that, but this was in the original metrics as well. And figuring out all of the nuances of this, I have not gotten there yet. I apologize for that. If you go to the next slide, please. This is where the new information is in the county allowances. They separated the counties of different sizes. We fit into the larger population county of more than 30,000, population density of more than 6 per square mile. So we still are at the less than 30 per 100,000 in the previous 3 weeks. So some allowances, particularly for K through 3, could potentially happen for in-person learning there, and the test positivity less than 5. The clarity here is that a public or private school that is remote and rural with an enrollment of less than 250 and no more than 10% of the students living outside the school's catchment area may have increased in-person learning. This just came out on Tuesday. I really don't know that we have any schools in Clackamas that would meet that definition. We're still looking into it. But at this point, I don't know that it makes any significant change for us because I don't know that we have any schools that would meet that. And that is all I have on that. Any questions?
Well, for me, you know, the timeline for when students go back to school has moved quite a ways out. Yet our timeline to get the school plans reviewed is the same, correct?
Yes. So there are nuances about this. We still have the same time frame to acknowledge receipt of their plan, and they still have the same time frame to have their plan for whatever model they are choosing. If they're choosing to have completely distance learning, they can submit that plan now, is my understanding, and then adjust their plans for any in-person learning. So focusing on that, you know, potential in-person learning for the limited on-site that may have allowances, work with them on that right now. The county's responsibility is to acknowledge receipt of the plan and acknowledge that we will work with them. I personally, as a local public health official, want to review those plans before I tell them that I've reviewed it. But I can still send the letter in the time frame that we have.
All right, thank you, Sonia.
Yeah, I'm curious. I'm really concerned about the disparities that are going to occur with some children being really left out of learning. And I am wondering, I think I asked Nancy this question a couple of weeks ago, and she said conversations were happening about creating mini pods and potentially using paraprofessionals to help teach kids in very, very small groups and maybe even outside of a school setting. I mean, during the pandemic of, was it 19, what was the year? I can't remember the year now, but wait, at
1918?
1918, they actually educated kids outside and did that. I mean, it's like, oh, well, if that works, that might be something we should think about. I talked with a superintendent about this concept, and there's been, you know, for very limited some conversations, but I'm just wondering if there's do you know anything else about this idea? Parents with means are hiring tutors. They're setting up these little mini schools. They're doing this. They're paying for it. But children that have parents that have to work to maybe work a couple jobs that may not have the greatest internet. I mean, this is a real concern. So I'm curious what you know. And then I'm also wanting us as a commission to be thinking about this to see how we can have an advocacy voice on this issue.
I know what you just stated. I do not know what level of conversation around this is happening at the Oregon Department of Education as far as learning pods that would be sanctioned through the school districts versus sort of privately organized learning pods. I do know that they're happening. I do know that we've had some conversations with the region around determining our approach to this, and I don't have anything further. Nancy, do you have anything further to add? But there is a concern, yes, a concern for disparities of children who are going to have access to education in equitable ways.
That's basically what I know at this point too. I do know that there's conversations, you know, at the state level as well as some here locally, but I don't know any details around that.
Okay, if we could continue to be updated and if there's more information and what our role is, it'd be really good to continue this conversation. I know that Russia apparently has a vaccine and we should all be done with this very, very soon, but I'm just not feeling so confident. I think I would feel much more comfortable if we all use our best thinking to plan for a longer term, especially for our kids. So appreciate your thoughts very, very much.
Yeah, get a flu shot. Martha.
Yeah, thanks for that. I do want to mention that Ken and I had a conversation with the superintendents at the ESD about this very issue, because what they're struggling with is not only the folks that can do, you know, have the tutors, have the pods, but the inequity with internet access is huge. And they are struggling right now to try and figure out how do they make sure that not only do they have the iPads, the computers, and the things they need to work with at home, but also the speed and the ability to get on the net to really do the online learning. Ken, did you want to add anything to that? Because you were there. Yeah. But that's,
I don't need to add anything, Martha. You're saying it perfectly.
yeah. And the bottom line is that talking to those folks, to our education professionals, that's been the focus right now. How can they, you know, who pays for that? How do they get the dollars? I mean, how do they supply the appropriate equipment to kids? And once they have the equipment, again, is there even access in the rural areas or other areas that have spotty coverage?
All right. Any other questions? All right, Gary, are they free to go?
That is it for our COVID-19 updates today. Thank you very much, Nancy.
Thank you.
Dr. President.
Thank you.
All
Thank
right,
you.
we're going to move on. You have quite a busy agenda before you, commissioners. First, you have 2 public hearings. The first public hearing is first reading of an ordinance amending Appendix C, Local Contract Review Board Rules of the Clackamas County Code. We have Andrew Naris from County Counsel, who will lead this discussion. Actually, that's Andrew Naylor. So Andrew Naylor will lead this discussion. Please go ahead, Andrew.
Good morning, commissioners. This is an issue we discussed briefly a few weeks ago at Issues. It is a small change to our local contract review board rules. It adds a layer of administrative review when the county donates personal property. The general process for disposals of personal property is a competitive bid proposal scenario with the goal of maximizing return to the county. There's an exception for certain nonprofits, governmental entities, things like that, but there is no review process in place. There is a concern that some valuable personal property may be donated and the county could perhaps receive greater value if it was not donated under that exception. So this change adds a additional administrative review where the county administrator or their designee will review and approve any donations under this exception to the general personal property disposal scheme. That is about it. It is pretty straightforward. I'm happy to answer any questions or hopefully address any concerns this board may have.
Do any commissioners have any questions? I don't see any hands. All right. Thank you. We'll move on to, I'll open the public hearing and ask Dylan to please moderate this portion.
Great. Thank you very much, Chair Bernard. I'm Dylan Blaylock with Public and Government Affairs, and I'll be coordinating both public comment for this specific public hearing and later on for general comment. If any attendees would like to provide a comment specific to this public hearing, the local contract review board rules, you can do so now by utilizing the raise hand feature on Zoom. If you're on the phone, we do have a phone in. You can also hit *9 to let me know that you have your hand up. Again, we'll open up public comment on any topic related to county business in a little while, and we have a different public hearing coming up. But if you have a comment related to these local contract review board rules, please hit the raise hand button now. Seeing none, Chair.
All right. We'll close public hearing and I'll ask for a motion, read the ordinance by title only.
So moved.
Is there a second?
Second.
It's been moved and seconded that we read the ordinance by title only. I'll ask the clerk to please poll us.
Commissioner Fisher,
Aye.
Commissioner Humbertston,
Aye.
Commissioner Savis,
Aye.
Commissioner Schrader,
Aye.
and Chair Bernard.
Aye, motion carries unanimously. I'll announce that the second reading will be Thursday, September 10th, 2020 at a board regular scheduled business meeting at 10 a.m. And then Gary, what's up next?
All right, thank you, Andrew. Next, the second public hearing is a resolution for referral of a ballot measure to the voters of Clackamas County for a 5-year property tax levy to fund children's safety services. Stephen Madkour, County Counsel, will lead this conversation and I will assist him. Go ahead, Stephen.
Thank you, Gary. Good morning, commissioners. We are here for hopefully the last time because tomorrow's the deadline to submit it to the clerk. But we are here to discuss the current wording of the Children's Safety Services Levy. I circulated to the board 2 updated versions to make sure we're all working from the same set of documents. We have the ballot measure, which has a August 12:46 p.m. footer. We have the explanatory statement, which has a August 12th, 12:40 p.m. footer. First off, we'll start with the ballot measure itself. And this is the 812 version. This version has been revised from the version that was circulated last week after the board had a Tuesday policy session. We have received comments from external proponents as well as internally. I have, to the extent possible, incorporated those comments into the document itself. Some of the recommendations would have resulted in exceeding the word count that we have on this ballot measure, so those were left out. We have also received a request recommendation that in the caption, commissioners, of the ballot measure where it says 5-year local option tax for children's safety services, that we switch out tax and substitute that with levy. I support that change. Basically, they're the same thing, and it's more consistent with some prior levies that we have put out beforehand, such as the law enforcement levy, local option levy. So that would be a change to the document that you have in front of you currently. We also had a discussion. It was one of the undecided points last week, was the initial language submitted by the proponent said administrative costs by the county shall not exceed 5%. We raised concern to that because at those numbers and that percentage, it might be an extra cost to the county that would be incurred beyond the 5%. It would not be fully funded. Administrator Schmidt and a variety of other county departments met and discussed the administrative cost component, and that result of that was circulated to you last week, where I believe the number was upwards to $600,000 to $700,000. So we recommend, and the proponents recommended, and internal staff recommended, that the board consider striking in its entirety any reference to administrative costs, either in the ballot measure or in the explanatory statement, and allow that the county, if this does pass, the county would be able to charge the fully funded rate against the levy proceeds itself without there being a cap imposed upon that. So that would be a little bit more of a cost neutral component. If the board were to pass the language with the recommended changes that I just discussed, or any others, I would reduce it to the Form 805, which is the Secretary of State's form, and I would sign it on behalf of the board, and we would deliver it to the clerk either this afternoon or tomorrow, because it is due tomorrow as the final day. The clerk will publish it in a local publication and on the internet, and citizens, that starts the process for it to be on the ballot itself. And I am available to answer any questions that the board or others may have.
Martha and then Paul. Oops. Martha?
So, Stephen, I have a question, because what I have before me is, frankly, some information from Adam Freer from the Children, Family, and Community Corrections. And he made some suggestions that I don't see incorporated into the current document, the caption. And I guess my question to you, is that largely because of the word count issue?
It is, Commissioner, and he did, and that's one of the internal comments I was talking about previously. And I can pull it up. He recommended, and
Somebody
if you over it,
needs to
he
mute.
recommended in the caption itself, that is by law is limited to 10 words, He wanted the word 5-year. Well, let me preface this by stating that the caption and the question presented were verbatim that you have in front of you, other than the last recommendation of the word levy substitute for tax. That was a verbatim from the proponent's item that was circulated to us about maybe 3 weeks ago. So we haven't tinkered with that at all. But his recommendation was to add the words 5-year local option tax for children's safety. His recommendations were prevention and services. So that would add 2 additional words to that. He also recommended prevention and services to the question presented. So that both of those would, on my last count, they were going to bump them above the maximum allowed. And we did incorporate, though, we used some of his other language within the explanatory statement and also within the summary of the item itself.
Martha, you're on mute. Martha, you're on mute.
Yes, I'm trying to be respectful because there's another conversation going on in the background that I hope isn't disturbing the meeting. So I guess my question is that you believe the explanatory statement, Mr. Madkour, could you help me with this, actually also implies that prevention services can be, or prevention interventions can be part of this levy without adding the language to the caption?
Absolutely. It doesn't need to be in the caption at all when you're talking about the full range of services. And I will also point out that the wording of a 5-year local option tax for children's safety prevention and services kind of makes no sense. Children's safety prevention. Not entirely sure what that means. I think it's a little bit more confusing than it is illuminating. But we did include the word prevention in summary, where it says the measure would finance the Clackamas Children's Safety Fund dedicated to providing a full array of child abuse and neglect prevention and child safety services for Clackamas County children and youth impacted by violence, abuse, or neglect. We also included the term prevention, Commissioner Schrader, in the explanatory statement as well. So it's in both documents. So it's clearly, in my estimation, covered as a service that could be provided if the levy were to pass.
Okay. And the reason when I read Adam's reason, what he says that, okay, it implies that the new tax will increase child safety. However, services to maltreated children do not usually increase overall child safety across the population because they're addressing the issue after the abuse has occurred. And I think that's a fundamental need that we have in this county. And I do believe that we have significant nonprofits who are addressing that need. But I think our responsibility as commissioners is also not only to support the nonprofits that are actually working with children who are significantly suffering trauma and damage, but it's also our role to try and catch it earlier and sooner. So we're doing it at the front end as well as the back end as a continuum. And I just want to state that for the public record, because I think that's our job is to really look at the full deal of what we have to do to have children safe in this county. And I do think prevention is a big opponent. However, you have assured me that that is a significant piece of this. So I'm not going to suggest we directly add any of that language then in the caption or that particular statement. It seems as if it's taken care of in the rest of the body of the issue. So thank you, Mr. Madkour, for all your hard work. I really appreciate it.
Certainly, Commissioner, thank you.
Paul.
Yeah, I think both documents, I think with all the eyes, and they've looked at this, all the good work, I think I'm for the most part, absolutely just one question or clarification, I'm good to go, and to open the hearing. But I do want to ask a question. How do we memorialize the full cost recovery goals of the
Yeah.
county, absent putting them in the docs? Is that something we can do afterwards, after it's approved? I mean, what does memorialize that?
I would recommend against putting any such granular detail in the levy itself, leave it silent. And if it passes, when we talk about the formation of it, the committee, one of the first things to do would be to create a cost line item where you would bill against this, all county services devoted to getting this up and running, administering it, monitoring it, and oversight would be billed towards that particular cost center. That would be one of the first things that would come from county administration.
Yeah, I guess I just want to make sure that there's a mutual understanding amongst all of us involved in this, that we agree on that full cost recovery aspect, so that it's doesn't become an issue after the fact.
Yeah.
And of course, there's people that are not aware of this. I don't have that much of an issue with the folks that are involved currently, so much as I do a little bit of concern about this being raised afterwards by people that are not yet involved or aware. So that's all I'm trying to do. And I know we have communications and public records, and even these meetings and this discussion, that's our intent, and that's what we're doing. But having that codified, memorialized, I think is important at some point. And you've answered my question. I'm good to go. Thank you.
Well, I think that's something that we could talk to Gary about doing. I'm sure there's a way to memorialize that, which I totally support. Ken.
I appreciate Commissioner Savas bringing up the full cost recovery. That was my issue also. I just said remind everybody that our policy as a county board of commissioners has been to direct all of our departments wherever possible to have full cost recovery, especially given our budget situation. We are simply not in a position to underwrite additional new services of any kind without also getting full cost recovery. So our policy already memorializes it. We may just have to, as Commissioner Savas suggests, remind people of that periodically.
Commissioners could include some language to that effect in the explanatory statement if you are so inclined. You do have room for additional language in there.
I'd rather do that outside with Gary and the rest of us in some sort of policy that goes beyond this. I think if you do it on this, then that's just this, when we want to do it on everything. So we're gonna, I'd like to read the motion when we're done, because I've changed it slightly, very slightly. But first we have to open up for public hearing, and I'm going to turn this over to Dylan to moderate this portion.
Very good, Chair. Okay, if any attendees would like to provide a comment specific to this public hearing, the referral of a ballot measure to the voters of Clackamas County for a 5-year property tax levy to fund children's safety services. You can do so now by utilizing the raise hand feature on Zoom. You can also hit *9 if you are on the phone and you would like to raise your hand. It signals to us that you have something to say. Again, we'll open up public comment on any topic related to county business in a little while. Also, Chair, I have a couple of emails specific for this hearing, but I see some of the people are attendees, so they may provide their comments over Zoom instead. We will see. Okay, the first one is Robin Christian. Robin, if you could go ahead and unmute yourself. There you go. If you could provide your name, your area, and please keep your comments under 3 minutes. Thank you very much.
Thank you so much. Good morning. I'm Robin Christian, Executive Director of CASA, Court Appointed Special Advocates of Clackamas County. First, I want to start with a huge thank you for all of you and your work on a very condensed timeline, condensed being the operative word, to refer this levy to the ballot. ACEs, Adverse Childhood Experiences, scores for children in foster care are higher than that of war veterans. Children in foster care have complex trauma histories, and the system itself generates traumatic experiences. Trauma and neglect are proven to have significant repercussions on brain development, which leads to other issues. Cases assigned to a CASA volunteer tend to involve the most serious cases of maltreatment in which the children were more at risk. A child with a CASA volunteer has significantly fewer placements than a child without a CASA volunteer. A child with a CASA volunteer is less likely to re-enter the child welfare system, and the proportion of re-entries is consistently reduced by half, saving taxpayers money. Children with a CASA volunteer are more likely to achieve permanency rather than languishing in foster care. When a CASA volunteer is assigned, a higher number of services are ordered for children and families. Currently, there are 373 children in foster care in Clackamas County. 41 of them are waiting to be appointed a CASA, and we anticipate an exponential increase as schools ramp up and mandatory reporters begin to interact with children more regularly. We know that abuse is happening in isolation. We also know it's not being reported. Lastly, research shows that children with a CASA volunteer report significantly higher levels of hope, something in short supply these days. I think we would all agree that hope is something that everyone could use more of, especially children in foster care. Thank you for the opportunity to share this information with you.
Oh, Chair,
Jim,
Chair, you're on mute.
Robin, thank you for the work you've done to bring this measure forward. But the hard part begins if we decide to put this on the ballot. So thank you very much.
Very good. Thank you for that, Robin. Next, we're going to go over to Catherine. Catherine, if you could go ahead and unmute yourself. There you go. Please provide your name, your area, and keep your comment to under 3 minutes. Thank you very much.
Good morning, commissioners. My name is Catherine Koch. I live in Portland, but I've worked in Clackamas County for the last 10 years. I'm a licensed clinical social worker, and I have the pleasure of working with Clackamas Women's Services, and I've been with them for the past 10 years, currently holding the Children's Program Manager position. I want to start by thanking all of you for your consideration around the Child Safety Levy on November's ballot. I feel like this is an incredible opportunity for our community. During my time at CWS, I've had the opportunity to connect with many children and families within the community who've been impacted by domestic or sexual violence. And it's been incredible to see the community come together over the past 10 years to support our families. Time and time again, I've witnessed the healing within families when there are resources for supporting a wide variety of needs. I appreciate the conversation around prevention and intervention because I think it's important that we pick up this from both ends of the spectrum. So being able to provide families with safety planning, counseling, mentoring, so kids have connection to safe and supportive adults in the community, as well as opportunities for children to access support groups so they know that they're not alone in the violence that they've experienced is really important for healing to be able to begin. What we know is that abuse can be an incredibly isolating experience, and that's been compounded with COVID's pandemic. We know that to be true. But what I also know is that within the work that I've done, the connection points that we have within Clackamas County, support services where kids have the ability to connect with other folks who've been impacted by violence similarly to them, opportunities for connecting with safe and supportive adults, and opportunities for families to come together to be able to connect with one another is vital for families to be able to heal. The Child Safety Levy, when I think about that, it's an incredible opportunity to support survivors in our community by supporting the connection points they have to safe individuals, and it can open doors to create a safer community where everyone has opportunities to thrive. I've done a lot of work within the county, specifically with our Camp Hope program, serving a lot of kids and families who've been impacted by domestic violence. and appreciate what Robin said about hope. We know that hope is built when folks are able to see pathways forward. And for survivors and children within our community, that means access to physical and emotional safety. And I really feel like the Child Safety Levy is a good start to that. I appreciate each of you for your leadership within our community. And I'm just really grateful for the opportunity to be able to talk with you today and the consideration around the Child Safety Levy. Thank you so much.
Thank you, Catherine.
Excellent. All right, thank you very much for that comment, Catherine. Next, we are going to go to Charles Gallia. My apologies if I'm mispronouncing the last name. Charles, if you can go ahead and there you go, unmute. Please provide your name and your general area and keep your comments under 3 minutes. Thank you very much.
This is Charles Gallia. I live in Carver. Thank you, Chair Bernard and commissioners, for moving this levy forward. I also want to commend the staff for doing a remarkable job in the turnaround. Some of you may be familiar with my background, but I've been working in the healthcare field primarily for low-income people in Oregon for almost 20 years. I was a co-founder of the Oregon Pediatric Improvement Partnership, and I'm currently working with Johns Hopkins at the Child and Adolescent Health Measurement Initiative that is addressing ACEs as a public health perspective. I'm really glad that we're taking steps to do a comprehensive step in moving Clackamas County into addressing one of the most seriously neglected areas, and that's the abuse of children. The comprehensive look that includes prevention, I think, will move us quite a ways at not only saving short-term costs, but some of the long-term costs of intergenerational abuse that usually follows as a result. One of the things that I know about ACEs is it's a little bit like the Myers-Briggs in that pretty much everybody knows what their ACEs score is now. And it's almost like a little bit of a game, whether you're a 5 or 4 or a 2 or a 10. But the reality is that those have consequences. And it's really time, and I'm very proud that I live in a county that will take the steps to do this now. As we reemerge from this COVID-19 experience, we're actually reimagining what we're going to be like as a community. And this is one way of making sure that the most important connections are built. I'm committed to supporting the levy as it goes out. And I just want to, again, commend you for demonstrating the political courage and leadership in this area. Thank you.
Thank you, Charles.
Okay, excellent. Our next comment comes from Jory Monroe. Jory, if you can go ahead and unmute yourself. Very good. And please provide your name, your general area, and keep your comment to 3 minutes. Thank you very much.
Hi, thank you. My name is Jory Monroe. I am a prevention specialist and a support coach at Northwest Family Services. I live in the Portland area, but work down in Oregon City at Ogden Middle School and Cracksburger Middle School in Gladstone. First of all, I just want to say thank you guys and your staff for all the hard work on behalf of Clackamas County youth and children, and in particular, your support for the Children's Levy. I just want to tell a quick story of one of the youth I work with. I lead a number of after-school programs, and I am a one-on-one case coordinator, kind of a multifaceted job. This in particular student, he joined my after-school basketball class that I teach last year. Was really shy, really withdrawn, didn't have a lot to say in the class, but I could tell he had a keen interest in basketball. After leading this class for a little while, I reached out to some administrators, some teachers to kind of find out more about this student. He was in 7th grade at the time, and I work with 8th graders. So I thought he might be someone to put on my radar for my one-on-one caseload next year. Come to find out, this student had been struggling with homelessness for the majority of his childhood life. And I really kind of targeted him as someone next year in my 8th grade caseload to take advantage of, and all the administrators were on board with that. Fast forward, this student was on my caseload the next year, and we had this relationship built already, and he was really interested in this basketball club starting back up. I told him that it was going to, but I also wanted him to join an organized basketball group. And after I explained how it looked and we pulled up starting days and schedule, this student agreed that he would be interested in joining. But the thing about it was he had no idea in how to join. He didn't know these activities existed, and he didn't even know something that us as just I kind of took for granted, that this student would know about all this stuff. He had no idea. We had to talk with administrators, his parents, some other students' parents in the program to get him to and from this program, because they also didn't have access to a car. And just after all of this, once he joined this basketball program, not only did his game in basketball improve dramatically, but he also went from being a student who flew under the radar completely, didn't get noticed much by his peers or teachers, to someone who was saying hi to everyone in the hallways, had a social circle. Teachers recognized him and knew him by name. And I think what that goes to show is that this simple participation in after-school basketball class and a one-on-one relationship with a caring adult ultimately helped this student build a healthy social circle, and not incidentally also improved his overall school performance. Oftentimes, these students don't get noticed as having a need simply because they don't cause trouble or raise any loud red flags. Having a trusted adult in the community who can come alongside them and guide them in a meeting with school counselors, talking to their teachers about assignments, participating in extracurricular activities, helps students like this to be noticed and to be given the opportunities that they deserve to help them grow socially, emotionally, and academically, I believe, and to put them on the path to success. Thank you again, guys, for your time and all your hard work on behalf of Clackamas County. I just wanted to share that quick story with you.
Thank you, Jory.
Excellent. All right, next up we have, the handle is John Wentworth. So Mr. Wentworth, if you could please provide your name, perhaps your title as well, your general area, and keep your comment to 3 minutes. Thank you very much.
Thank you. John Wentworth. I'm the district attorney-elect of Clackamas County. I also serve on two nonprofits that serve abused children, both Parrot Creek and the Children's Center. I would like to thank the commissioners and their staff for diligently working on this very important issue. This isn't the first time you've worked on something so diligently, and I appreciate it. I think if there's one role that government has to play, it's in the area of protecting the safety and welfare of its citizens. And this levy goes to the heart of that issue, because it's not just protecting the people who live in Clackamas County, it's protecting the services to our most vulnerable populations, which include abused kids. And so thank you for that effort. There's already been discussion about adverse childhood experiences. We know that there are health effects from kids who suffer trauma and abuse, mental health issues later in life, substance abuse issues, heart disease, liver disease, obesity, just to name a few. There are socioeconomic effects that come from being traumatized as a child that include doing poor in school, which can result in having less opportunity in the area of getting a good job as an adult. There are divorce rates that are higher. Kids who suffer witnessing domestic violence have a higher rate of committing domestic violence as adults and being victims of domestic violence as adults. So if we can help curb this trauma early on, and that's what these nonprofits do, they get to the heart of dealing with trauma at the earliest stages, we have a better chance of keeping people out of my area, which is that of the criminal justice area, as adults. We have a better chance of keeping adults out of hospitals. We have a better chance of ensuring that our citizens are safe and healthy and productive members of society once they become adults. So when I say that the services these nonprofits provide are critical, they are critical. And thank you so much for putting the time, the effort, the blood, sweat, and tears into making this happen. It's deeply, deeply appreciated. Thank you.
Thank you, John. Dylan?
Yes. All right. Thank you for that, Mr. Wentworth. Next up is going to be Simon Fulford of Parrot Creek. So Simon, if you could please unmute yourself. Very good. Provide your name, area, and keep your comment to 3 minutes. Thank you very much.
Okay, thank you very much. My name is Simon Fulford. I'm the Executive Director of Parrot Creek Child and Family Services based here in the county. Just first off, Chair Bernard, Commissioners, firstly, I want to thank each of you for your unanimous support for putting the Children's Safety Levy to the voters of Clackamas County. Based on the very robust independent polling that was undertaken, and knowing how deeply communities here in the county care for their children, I am very confident that the levy will pass by a strong margin in November. I want to thank all of you for leading with both your heads and your hearts in the deliberations that you have undertaken to get us here. As you know, the Children's Safety Levy was designed to help the county meet the acute needs of children and youth who are victims of abuse, neglect, and or exposed to violence, and to prevent further harm. The framework for the levy targets community-based nonprofits as the very best organizations, able to reach those children currently falling through the cracks and those at risk of doing so in the future. Nonprofits are some of the most trusted entities in our communities. They are led by and supported by local citizens. They know or can reach families who are often missed by more formal systems of care. Nonprofits have the reach, the nimbleness, and the flexibility needed to quickly respond to both a local crisis and the emerging, ever-changing needs of children and families. Nonprofits focus on the social determinants of health, as other speakers have shared, and use robust, evidence-based programs to positively impact on the multitude of adverse childhood experiences that sadly too many children are victims of or at high risk of exposure to. Nonprofits also reflect the communities they serve. We hire local staff and we mobilize local volunteers. At Parrot Creek alone, over 85% of our staff live here in Clackamas County, creating more than 35 local jobs. Finally, both local and nationwide analysis shows the multiplier effect of investing in services provided by community organizations. Nonprofits make every dollar they receive work more than once, often using local funds to match private donor gifts and/or state and federal grants or contracts. Together, the growing list of organizations that are part of the Safe Kids Coalition draw in tens of millions of dollars for a broad array of much needed programs and services directly serving the citizens of Clackamas County. These levy funds will help children heal and prevent further victims of harm. I also submitted written testimony by email from our youth, which Dylan can read if their time permits. Again, I want to thank you for your very heartfelt support of the Children's Safety Levy. Thank you.
So Simon, I have a question.
Yeah.
I understand that we may have an agreement on the disposition of the property.
Uh-huh.
Thank you for your leadership.
Thank you, Jim.
Been 15 years, so.
Well,
I'm excited
done
to
in the
have
last
that. I'm excited to have that before the commission.
Thank you. Very much appreciate that.
Thank you. All right, Dylan.
Yes, Chair. The next comment is going to be from Cole Merkel. So Cole, if you can go ahead and unmute yourself. There we go. Please provide your name, your area, and keep your comment to 3 minutes. Thank you very much.
Commissioners, thank you for the time. My name's Cole Merkel, and I am speaking solely as an individual in Oak Grove, taxpayer and property owner. I simply want to say thank you for considering this absolutely critical measure. I think that our advocates in our county have spoken quite clearly that our kids need us to step up, especially now, and that they need this funding to be able to do the work that they're doing. We have an absolutely critical opportunity to support our most vulnerable youth in Clackamas County, and I will say that my partner and I would be proud to have our property taxes pay for this measure. So please refer it, and thank you so much for the time.
Thank you, Cole. Dylan.
Excellent. Okay, that was the last hand that I have up, Chair, though we did get one email. It was also from Simon Fulford about the testimony from a youth. Would you like me to read that, Chair?
Please.
All right. So again, from Simon Fulford, the Executive Director of Parrot Creek, please find this youth story drawn from case notes by our therapists. And it just goes right into the story, Chair. I was born just outside Malala. My mom looked after me and my 3 brothers and sisters while my dad worked at what my mom called the shop in Canby. When I was about 3, Mom says Dad lost his job and his drinking got worse. I remember the day he left. It was after my 5th birthday. Mom had got a boyfriend who I didn't like. He moved in. He would hurt me and my little sister at night in the room we shared. Mom cried a lot. Mom's boyfriend would hurt Mom too, and my older brother would scream at him. Grandpa says the scars on his face are from when he was thrown through a window. I don't remember that. My first memory of the social workers are when they took us away. The sheriff had a shiny badge. He seemed nice, but everyone was crying. I liked his gun as it reminded me of shooting in the woods with Grandpa. I didn't really understand, but the new family were really nice. I had a bigger room and everything was so clean. That was the best part. Things were clean and the house was calm. Mr. and Mrs. Johnson, not their real name, had 2 cool cars. I would see my siblings on the weekends. I cried a lot and would get really angry. I didn't like the kids at school. I hit a teacher, and that evening I had an accident playing with matches. My bedroom was on fire, and Mrs. Johnson got real scared, so I went to live with another family. They had other kids like me who didn't live with their moms. They were nice at first. We ate burgers on the grill in the backyard, and I remember a lot of music. I remember my new dad had buddies who would sit my new sisters on their laps. Sometimes late at night, the music would get real loud, and I think these men came in the house. My new sisters often had bruises. One man came in my room and hurt me like mom's boyfriend did. That's when I decided to run away. I think you know the rest because we discussed this as my case plan, right? Do you know what I remember most? No one listened to me until now. I think I have met a lot of folks in my life, but they are all a blur. I'd like to remember people more. I'd like to stop hurting kids. No one hurts me anymore. I wouldn't let them. They know that now. If I get through my case plan, will I go home? And that was again sent by Simon Fulford, relayed to us by Simon Fulford, to consider as we approve the levy for consideration by voters. If approved, levy funds could help turn this youth story from a tragedy into one full of love, hope, and aspiration.
All right, Paul.
I just wanted, yeah, that was quite the story. I had to just reckon back again to my first visit at the Children's Center about 10 years ago and how sobering that is. And a story like that is just so impactful. While we have at the county in the last week or 2 or 3 on this matter done a lot of work, hard work, and our staff and my colleagues have all chipped in, credits due, but it's, in all fairness, we have to acknowledge all the hard work from the coalition and all the members and the volunteers that provide the services, have done the work and the heavy lifting to get this to us, frankly. So while it, to some degree, I think that we've got the easy part, I think in all fairness, we have to, again, acknowledge all the hard work that's done on a regular basis and the work that coalition did to bring this forward. So I just want to just give kudos to all of those folks for their hard work. I think this is such an important issue. And, you know, the stories like that and the stories that I hear at the Children's Center, it's just unfortunate that any child has to go through something like that. So I am, you know, very happy today to support putting this on the ballot. Thank you.
Ken.
Thank you, Mr. Chairman. I think this is probably one of the more momentous things that we will have done as a county commission if this passes. It is always difficult to ask people to raise taxes. However, I spent 50% of my career in law enforcement working with juveniles. And I can tell you that the need far exceeds even what we're going to be able to do with these resources. I'm happy to support this. I hope that it passes. There's no question about the need. And I wish we had had some of these kinds of resources when I was working with kids that were the victim of these kinds of abuses and mistreatments and neglect. Thank you, Mr. Chairman.
Okay, Stephen, I plan in this motion to clarify those 2 issues, okay? I move we approve a resolution for referral of a ballot measure to the voters of Clackamas County for a 5-year local option levy to fund children's safety services and to amend the ballot title, striking the word tax, inserting the word levy, and to remove the sentence that says the county's administrative costs shall not exceed a certain percent. Is there a second?
Second.
Chair Bernard, I need to interrupt you. You have not closed the public hearing yet.
Oh, okay.
I noticed that. So with that, I closed the public hearing and we've made the motion and there's been a second. I want to tell a story though. I went, when I first got here, I went out with a lot of parole and probation folks and went to a house one morning that the police had to go to the night before. And they were drunk, fighting in the middle of the street. And I went in with them and the police were talking to them about what had occurred. And in the house was a little boy. I would guess 5 or 6, behind a gate in the kitchen, and he could not speak. He could not speak a word that I could understand. This is a 4 or 5-year-old kid. And all I could think of at the time was, somebody got to report this. I mean, this kid's life is going to be very hard to live when you can't speak a word at 4 or 5 years old. But I think that because of this levy, should it pass, the voters support it, there's a lot of opportunity here to have taken that, well, to tell the sheriff who was, or the probation guy, to contact somebody, a certain group or department, and report this so that this little boy could get some help. It was just terrible. And this was a Lake Oswego kid. So it happens at all income levels. And with that, Martha, you have your hand up.
Yes, I did, but I'll wait until Commissioner Communication.
Okay. Well, we're ready to be polled.
Commissioner Fisher? Aye. Commissioner Humbertson?
Aye.
Commissioner Savis?
Aye.
Commissioner Schrader?
Aye.
And Chair Bernard?
Aye, motion carries unanimously 5-0. Thank you all very much. And again, Stephen, thank you because you really worked on this.
Team effort, Chair, but thank you too.
Thank you.
We'll get this
Gary.
done.
Thanks for allowing us to do this.
All right, Chair, we actually have to go back to the first public hearing. We missed a step. This was the first reading of an ordinance amending Appendix C, Local Contract Review Board Rules of the Clackamas County Code. You made a motion for the clerk to read the title by ordinance, to read the ordinance by title only, and the clerk had not had a chance to do that yet. So, Christina, can you please read the ordinance by title only and assign a number?
Yes, this ordinance will be 072020, amending Appendix C, Local Contract Review Board Rules.
So should we go through the process again? Voting on it?
No, we're okay, because you already you approved to read the ordinance by title only. Christina just didn't have a chance to formally read it and assign a number, but she's done that. Is that right, Stephen? We don't need another motion, right? Okay, he's saying we're good. We're good to go.
This is my first meeting.
Mine too. Okay, very good. Thank you. And thanks to Christina for catching that because I missed it. All right, now commissioners, moving to discussion item, Health, Housing and Human Services, approval of a resolution declaring a state of emergency and emergency measures to address housing crisis. Vahid Brown from Health, Housing and Human Services will present. And as soon as he's in here, he'll unmute. There he is. Vahid, please go ahead.
Thank you, Administrator Schmidt. Good morning, Commissioners. This item was before the Commission on August 4th. This is a consideration of renewing a declaration of emergency, declaring an emergency related to housing and homelessness. This was first declared in 2017 by the Commission, recognizing that the increasing number of county residents, including families and children that are considered homeless, the need for safe, warm, and habitable shelter for the homeless population, and the recognized lack of adequate temporary or emergency shelter for the county's homeless population does indeed constitute an emergency. That resolution was renewed in 2018 and again in August of 2019. The resolution of emergency, the board opted to follow measures, or to allow the county to follow measures necessary or potentially necessary to address public safety related to the housing crisis, including committing to mutual aid agreements, suspending standard competitive bidding procedures to obtain necessary goods, services, and/or equipment, redirecting funds for emergency use, ordering such other measures as are found to be immediately necessary for the protection of life and/or property, authorizing county staff to explore the acquisition temporarily or permanently by purchase, lease, or otherwise of sites suitable for shelter, and waiving Clackamas County Code regulations, administrative rules, and fees to the extent necessary and possible to respond to the housing emergency. And I believe in your August 4th meeting, you discussed some of the ways that Health, Housing, and Human Services and other departments had used this housing emergency to address the housing crisis since its passed in 2017. But it is the recommendation of Health, Housing, and Human Services that the board renew the emergency, as the conditions, underlying conditions that were recognized as an emergency by the board in 2017 have not improved and have in fact gotten worse. And I'm available to answer any questions the board might have.
So, just a second. Sonia.
Vahid. So I'm really concerned about winter shelter. And I know when I review the reports that we get that you're working hard on planning for that. I'm hoping that you can shed some light on us about what that might look like for this winter. And also, I believe you're aware, there is a program called I think it's called the Turnkey Project, and Oregon is looking at that. It was done in California. It's a process of leveraging CARES dollars to purchase motels that are being sold at very reasonable cost. And I'm just curious where we're all going and if that might be an option, if we're coordinating, looking at leveraging some of those dollars, or how in the world are we going to winter shelter in this COVID world?
Yeah, and that's that's a keep me awake at night question too, Commissioner Fisher. So the sort of plan A, the strategy we're pursuing and hoping to successfully pursue with respect to winter shelter involves motels, not the outright purchase of the structures, but a similar program being pursued in Multnomah County where blocks of motel rooms are rented at a negotiated rate with motel providers. In many cases, all rooms in a motel, and at a scale that would meet the expected need, looking at data from previous winters and the numbers of people who we sheltered in winter warming shelters. Now, of course, the reason we're looking at alternatives is because our historic approach is congregate shelter, where you have many people in a room sleeping in a warm building and out of the elements. Under the pandemic, that's not an option for obvious reasons. And so the best option available to us is to attempt to acquire enough motel rooms using a mixture of CARES Act dollars and already allocated funds from the state for winter shelter, because some of them, many of them would be able to be justified under COVID CARES Act dollars, but not all of them, right? So the CARES Act dollars for emergency shelter allow you to shelter preventatively, but there are constraints on the population that you can serve in that manner. They have to be older than a certain age and have certain underlying health conditions, right? So younger, healthy people experiencing homelessness, we would need to use our other dollars, state and local dollars, to sort of mix them with federal funds in a motel strategy. And I'm saying that we're hoping that that's our successful approach because it is contingent upon successfully applying for FEMA match dollars for this. We are in the process of doing that. With the Emergency Operations Center, that is moving forward. Some counties in Oregon have successfully applied for those FEMA match dollars for the same kinds of programs. So I don't have any particular reason to think that we will not be successful, but it is a pending application. And so, as I think it was stated in the staff report for this initial item when you discussed it on the 4th, we will be in a difficult situation, and we'll have to pursue very quickly potentially alternative solutions. Things that we're exploring are the renting of large commercial spaces in which people could be spaced out quite significantly, but that would be a costly approach. The use of large military-style tents that can be heated, like these are sort of like the kind of things you would see at a wedding reception, and in which you could place individual dome tents, so there would be some separation of people. So these are less than ideal approaches that we would be forced to explore. And of course, those are the kinds of things that that in the past, in facing those kinds of constraints with respect to needing to respond to emergent needs for emergency shelter, we have relied on the emergency resolution for flexibility. Does that answer your question, Commissioner Fisher?
Yeah, it was really good. I am interested in all the conversations at the state, sort of using COVID dollars to leverage what can help us in our recovery as well. And that is in the governor's office now, but I'm interested in the advancing of that conversation so that we don't just use the dollars and then have them just be gone.
Yeah.
Good if they can be foundational to help us, because we know the recovery out of this challenge is going to be very significant. So I appreciate it. Thank you.
Martha, your hand went down. Did you not have a question? Gary, your hand is up.
Yeah, I want to follow up, Commissioners. Prior to COVID, you had asked staff to come forward to you on a policy session to discuss the rental or purchase of hotels for housing purposes, but that has not happened yet. Certainly COVID has changed the whole dynamic, but I want to caution you, please don't use the emergency declaration to bypass that policy discussion. So we can expedite that discussion with you about the uses of motels and hotels and what the county's role is in either rental or purchases. And we can expedite that for you. But again, you asked for that and it has not happened yet. So we can make sure that happens ASAP so you can be prepared to address it. Thank you.
And also, Wapato, the former Wapato jail has been converted to housing. And so it might just be a transportation issue. I don't know what the need's huge, but we could also look at transportation to facilities such as that. Anyway, Paul.
Yeah, I'd be remiss not to just mention that the COVID or the CARES Act dollars that we were anticipating receiving to help our constituents seem to be evaporating day by day, and not very much is coming our way. So I'd be remiss not to just state that at this point in time.
Yeah, we have in the bank maybe about $10 million more to spend, and we figure it's going to be $45 million. So unless there's more money from the federal government, from CARES to the local governments, it would be very difficult to buy a hotel or rent a whole hotel. We do have a contract with Washington County for rooms, but those are COVID rooms. So we'll see. Maybe the COVID issue will go away and we can put other folks in there. We'll see. With that, any other questions of Fahid? Seeing none, shall I entertain a motion?
Mr. Chairman, I move to approve the resolution.
Second.
It's been moved that we approve a resolution declaring a state of emergency and emergency measures to address housing crisis. And any further discussion? Please poll us.
Okay, Commissioner Fisher?
Aye.
Commissioner Humbertson?
Aye.
Commissioner Savis?
Aye.
Commissioner Schrader?
Aye.
And Chair Bernard.
Aye, motion carries unanimously. Gary, what's up next?
Next is your consent agenda, commissioners, and Christina will lead that.
All right. Let me go ahead and share this on the screen. The consent agenda for today, Health, Housing, and Human Services, approval of a subrecipient grant amendment number 2 with Todos Juntos for youth marijuana and substance prevention in rural Clackamas County, approval of local subrecipient grant agreement with Todos Juntos to provide evidence-based parenting education classes in rural Clackamas County, approval of amendment number 4 to intergovernmental subrecipient agreement with the city of Lake Oswego Adult Community Center to provide social services for Clackamas County residents, approval of an intergovernmental agreement with South Metro Regional Area Regional Transit, a department of the city of Wilsonville for transportation services to residents living in Villeboy community housing site, approval of agreement 9741, a lease agreement between Clackamas County Health Centers Division and Quest Center for Integrative Health for rental of clinical space, approval of 2019 through 2021 HB 2001 and HB 2003 Planning Assistance Grant Agreement with Department of Land Conservation and Development Grant number TA 21277, approval of a contract with Jim Turin and Sons Incorporated for the Salmon River Road Pavement Preservation Project. And that is your consent agenda.
Do any commissioners wish to remove an item from the consent agenda? Seeing none, I'll entertain a motion.
Mr. Chairman, I move to approve the consent agenda.
Second.
Been moved and seconded that we approve the consent agenda. Any further discussion? I'm going to turn it over to Christina for a poll.
Commissioner Fisher?
Aye.
Commissioner Humbertston?
Aye.
Commissioner Savas?
Aye.
Commissioner Schrader?
Aye.
And Chair Bernard.
Aye, motion carries unanimously. And by the way, it's Villebois. It's a French word. And Bernard is Bernard. French word.
No better.
All right. So we're on to public communication. I'm going to turn it over to Dylan. See if we have anybody who'd like to speak.
All right, thank you, Chair. This is the time of the meeting for general comment related to any county issue. If any attendees would like to provide a comment, you can utilize the raise hand feature on Zoom, or if you're on the phone, we don't have anyone on the phone. So go ahead and hit raise hand if you have a comment. And Chair, I also have one email related to public comment for after we take any Zoom calls.
Don't see any.
Nope, I do not see any hands, so I will read it. Okay. One email comment today from Mark Shull of Sandy. Storage of ammonium nitrate fertilizer has resulted in many catastrophic explosions in the past, the most recent in Beirut, Lebanon last week. In 1959, we experienced a horrible ammonium nitrate explosion in Roseburg, Oregon. Both the storage of this material and the transportation of it through our county is a concern. I bring this issue up as this is a good time for Clackamas County to increase public awareness regarding the storage and transportation of ammonium nitrate and to ensure compliance with state and federal law. Thank you for your consideration of the matter. Sincerely, Mark Shull.
Hey, Gary, isn't that what we got rid of at the sewage treatment plant, at the wastewater treatment plant? It was ammonia something.
I thought we did, yes, but I will confirm that for you.
Yeah, well, I know there was a chemical that was very hazardous that was gotten rid of. Paul, do you remember what that was?
Yeah, that's for it's not. It wasn't ammonium nitrate. It's ammonia disinfection. Is what it was for. It was for disinfection. So that was pressurized ammonia vessels, and that's very dangerous because they're explosive, and we've gotten rid of those. So.
Yeah. All right. Thank you.
Chair.
Oh, yes.
I think Commissioner Fisher has her hand up.
She doesn't get a talk.
I just had a question. I was thinking about that with the explosion in Beirut, and I was curious, Chair Bernard, you gave a presentation a while ago based on the storage tanks on the river if there was an earthquake, and that really brought to mind that terrible catastrophe in Beirut. And I'm just curious if you have any updates about that. It's been on my mind, especially lately.
You know, because of COVID, we haven't had a lot of meetings. Most of those have been virtual, and I've only chaired one, and that was not discussed. Those are, of course, gasoline, which is, I just can't imagine how dangerous that is. And one of the reasons the sunrise is so important is that's one of the routes that we would receive fuel to get the metro region back to work is when or if those things were to explode or leak. And so, no, we haven't really talked more about that. I know because they're privately owned, it's very difficult, but the Portland was going to look at passing some sort of measure and force them to do something to update or remove those storage facilities. That's all I know.
Well, the mishap, a terrible gross negligence in, that's my interpretation from what I see in the news, of what happened in Beirut really brings to light all the responsibilities that we have regionally and locally to prevent disasters that we potentially know about. So thank you for that update.
Thank you.
Chair, I did get one more email in just now.
Okay.
Okay. So this one is from Les Poole. This week's Clackamas Review includes an op-ed submitted by Milwaukee Councilor Lisa Beatty. It's about a recurring theme supported by county staff and many commissioners in the past, incorporating the Oak Grove, Jennings Lodge, Binsmead neighborhoods. I lived in Oak Grove for 20 years before moving a few miles to Gladstone. The picture created in Lisa's op-ed is not inclusive and implies that incorporation is a viable issue at this time. There is resistance to incorporation because another layer of government, one possibly controlled by special interests, isn't appealing. I am not opposed to incorporation, but have deep concerns about claims that the unincorporated residents don't pay their fair share, or that incorporation is a panacea. Unincorporated residents pay for water, sewer, parks, and library services. They consistently support a levy that pays for additional police protection in urban areas. Clackamas County Fire District Number 1 provides identical service to unincorporated areas as it does to the city of Milwaukee. No one is riding for free. Regardless of where one lives in the county, we all pay the new 10-cent per gallon state gas tax, the federal gas tax, and the new vehicle registration fee. None of those sources were mentioned in Lisa's comment about road funding. Perhaps the county tax assessor will include a breakdown of the property tax revenue in a future presentation. I don't believe we've received one since Bob Vroman retired. When it comes to fairness, most of the unincorporated residents are still feeling the sting of the North Clackamas Parks District lawsuit with Happy Valley. Meanwhile, the Parks Board recently approved $9 million to fund Milwaukee's waterfront park. The unincorporated residents of the district will be disproportionately funding a portion of Milwaukee's exotic plan. Ms. Beatty raised some good points, but failed to mention issues and concerns worthy of a much bigger discussion, a discussion that must involve rigorous application of Goal 1. For those who aren't aware, citizen involvement is Goal 1, and it was named as number 1 for an obvious reason. A process driven by Metro, Milwaukee, or other special interests will only result in more angst and division. Thank you, Les Poole.
All right, thank you. Now we'll close the public communication portion and ask our county administrator if he has any updates.
Yes, I do, Chair. I'd like to share some great things happening in Clackamas County right now. First, this week, August 9th through 15th, is National Health Centers Week, and I'd like to thank our staff at the health centers for the work they do every day to serve the clients and customers of Clackamas County. Our health centers care for more than 20,000 patients annually, and that number is growing, especially now because of COVID. So every day, our employees risk their own safety, to help take care of the safety and health of others. So thank you to our health centers employees as we celebrate National Health Centers Week. Also, as you know, commissioners, Clackamas County has retained its AAA credit rating from Moody's Investors Services based on our full faith and credit and refunding obligations. Clackamas County first received this designation in 2018, which was the first time ever we were rated AAA. And we all thought that we would lose that credit rating because of COVID and because we don't have a sustainable budget, which is quite well known. However, we were still rated by Moody's AAA, and they acknowledged that despite our not sustainable budget, we were taking steps as an organization and under your leadership to get there. And so I do want to call out, that's a pretty phenomenal accomplishment, that despite our budgetary challenges, we are still ranked AAA by Moody's Investors Services, a nationally recognized firm. So we have more to do. We have more challenges ahead, but I think this is a great recognition that you commissioners and staff are working towards right-sizing our budget. Finally, I want to recognize our Housing Authority of Clackamas County for the Metro Housing Bond funds and the 3 projects you recently approved. We were the first jurisdiction of the 3 counties in the Portland metro area that not only released the notice of funds available, but that awarded those projects. We are ahead of Washington and Multnomah counties. So once again, our fantastic staff at the Housing Authority of Clackamas County and under your leadership made that happen. That is my update for today. Thank you, Chair.
I'm surprised you didn't mention National Left-Handers Day. Are there any left-handers on the screen now?
Nope. Oh, Ken.
Ken's a lefty.
I didn't know that.
Well, congratulations. I hope you have a great day today celebrating.
I will.
All right. All right, we'll move on to Commissioner Communication, and Martha, you're up.
Well, thank you, Chair Bernard. I want to start by talking a little bit about some of the information that we've recently received from our Prosperity Zone initiatives. Because what we did as a commission, this is one of our main priorities, was really assess throughout the county where the areas of need were. And the areas that rose to the top, well, Milwaukee, which really showed a significant need in access to childcare, Estacada for housing, and Canby, which probably has one of our larger groups of Hispanic population, making sure that people have services to those things that the particular populations our Hispanic community needs to know and needs to have. And I think I've mentioned this before, that is particularly important to me because way back in the day, I worked with our local library system and I worked with our education system to make sure that our Hispanic kids had the tools they needed at the library with language appropriate books, as well as an opportunity to succeed in our public school system in the Canby area, the Canby School District. So I'm glad that we did that. But what I really want to mention at this point is the notion of childcare across this county, particularly during a pandemic, is becoming one of the more significant needs. And one of our jobs as commissioners is to not just work with our advocacy groups that have a proven track record, but it's also to identify emerging needs in our community. And so I know that there is a great body of literature about trauma-informed childcare. And I think it's very compelling. And I think any one of us can actually look that literature up and see how that is indeed, at least in my mind, part of the preventative continuum of what we do to help our most vulnerable populations. I was also very grateful to hear the testimony from our counselor in the school district, because as many of you know, I taught junior high school, I taught high school, I was a K-6 school librarian, and I experienced firsthand how important it is for our school districts for the professionals and our teachers, our superintendents and our principals must be involved in this, because they are the front line that oftentimes is the initial contact, not only for remediation of children that have suffered trauma, but also the preventative end. And I remember very vividly one day, as I was getting ready for the school library, and it was the school library was actually one of the safest places in the school. It was welcoming, it was happy, it was light, it was bright. And I encouraged children to come in. But one of the third grade teachers, we were talking in the hallway, and this little guy comes bouncing off the walls down the hall, headed towards the library. And the teacher turned to me, well, he must have had a bad night last night. The police have probably been at his house again. So I want to remind folks how important our education system is to this effort, and how we need to really honor our folks, our superintendents, our teachers, our counselors in the education milieu, particularly now, since we are struggling even more to try and figure out the safe way to open schools. And there's been multiple conversations of that. Spent this morning listening to that conversation with the regional folks, but even more so, how are they going to be accessing, kids are going to be accessing what they need with those folks that are oftentimes the first responders to what is actually going on. And I just want to make a statement that our job is not just supporting our nonprofits that we have worked with for many years and do important and significant work. It's also our job to look at the emerging issues that we're dealing with. It's also our job to look at prevention, because we have a broad mission as commissioners. Okay, our mission is prevention, as well as helping to support our advocates through our human resources program that are dealing with children that have already experienced trauma. And that is a different way of dealing with kids. If you catch it earlier, if you have that safety net earlier in place, I think the literature shows that indeed you can head off some of the later problems. So I do want to also make a statement that to our advocacy groups, I think you were very assertive. I appreciate that. It's very nice that you're thanking us, but quite frankly, I don't need the thanks. The people that truly need to be thanked is Gary Schmidt, Stephen Madkour, Rich Swift, Jill, Adam Freer, who actually looked at this, because I want to make it really clear to folks what a significant pivot this was for our staff people to move ahead with this quickly and efficiently, particularly during a pandemic, particularly when our resources are strained, when we are dealing with unprecedented issues with openings of schools, with how we're going to fund the response to COVID, how are we going to protect the public health. This was an added stressor. And I hope that as we move forward with this, people truly recognize that and don't thank me, because I'm old and cranky and I don't need anybody to thank me for anything at this point. Okay, I really don't. But you had better truly thank the staff, because we put them in a position, commissioners, where they had to work fast. They had to do it. Because we're commissioners, we always have to get our 2 cents in, and they performed in a way that I am absolutely astounded. They are honorable, decent people. And I would encourage the advocates, don't send me any emails, send it to them, because they're the ones that essentially made this happen. So in any case, I'm glad we've moved through this. I'm glad that we're going to be working with all the right folks. I personally, as someone who has served on Clackamas Women's Services Board, who is one of the founders of the Children's Center, who has worked with Parrot Creek for many years with John Foote, who's going to be replaced by John Wentworth, really honor and know the needs
But right now, I am currently working on the board of Clackamas Workforce Partnership, and they are identifying childcare across this county as one of the key components that families need in order to be functional and in order to give childcare the notion that yes, it is trauma informed. So I'm hopeful that we keep that in mind as we move ahead with appointing, if this passes, appointing a group that recognizes that as part of the continuum. So thank you for that, and I'm done. Great.
Ken.
Thank you, Mr. Chairman. I echo Martha's comments, particularly our staff did yeoman service in putting together all of this work in such a short period of time. It really demonstrates that we have an incredibly talented group of people working for the citizens of Clackamas County. On a tax-related note, as this issue has been, I had the opportunity to go out today to the Ferguson Road project, 2.5 miles of county road being repaved in the rural area of Clackamas County. And I just simply want to make the point that we made a commitment as a commission when we did the VRF to make sure that the roads in Clackamas County got taken care of and that every dime of that money would be spent on Clackamas County roads. And I can assure you, this is the second or third time now that I've been to different projects. And that is exactly what is happening. We have about 70 plus road projects on the books over the next 1.5 to 2 years that are being worked on. 25 of those projects are a direct result of the VRF that the citizens are now paying here to Clackamas County, and every dime of that is going into improving Clackamas County roads. I really want to commend our staff that are doing the work out there. And the administrative staff that put together these packages has done a great job of putting multiple different projects together that allow us to get a better bang for our taxpayers' dollars on these projects, which means that those dollars will go further and do more miles of road than we had initially anticipated. So thank you again, Gary, for the team that you have that is doing this work. And thank you to that team for the work that they are doing. And I hope that the public understands we are keeping our commitment to you, that every dime of these dollars will go into your roads, making transportation better in Clackamas County. Thank you, Mr. Chairman.
Thank you, Commissioner Fisher.
So what a momentous day today for us to unanimously refer the children's levy. This is incredible. And I have so enjoyed getting to know our coalition partners and their tremendous work in pulling this together and also in their advocacy. Really, really appreciated. I echo all the thanks that my fellow commissioners have said to our staff. Really, really great work. The testimony today was really heartfelt and compelling. And I think there's one piece that really struck me as being so important, and that is the ability for children that are in situations where they struggle, where they can connect with other children, to know that they aren't alone. And that's just such an important part of dealing through trauma. I just remember when, as I was growing up, and I've talked about this, that my mom struggled with substance abuse, and while half the time she was the most, or more than half the time, she was the most wonderful mother in the world, when she would drink, she would be drinking for days, and I would always think, this isn't normal. I need to tell someone. This is wrong. This is just not the way it should be. And then she would be the wonderful mother and take me on bike rides and go stomping in mud puddles, and we'd make cakes and do things. And then I would think, oh, well, that didn't really happen. My mom, that time when she was yelling all night, that wasn't real. That didn't happen. that's how I spent my childhood. Never had the ability to connect with other kids, to know that I wasn't alone. I just really thought that this was my total unique experience. And because of that, those struggles, you know, I'm a strong proponent of counseling and dealing through all those issues. And I've been, had the opportunity to try to undo all of those things through my adult life and work really hard on it every day. But it's, this children's levy will make a huge difference in providing support to kids to meet their unique needs. And it's really, really important. So I'm going to challenge each of my commissioners to endorse, officially endorse on the measure. I will be endorsing. I will be working with the coalition to help pass this. I want to encourage all of us. Now we've referred it. Let's fight for it. Let's take this to the voters and say, this is important. And let's put our names and our hearts and our soul and all of our energies behind it, because this is what we as leaders are called to do. That's what I've got for today. Thank you.
All right, thank you. So Paul.
Yeah, well, it's been as I mentioned earlier, it's been a somewhat strenuous 3 weeks as we move this forward, and acknowledge all the hard work that our staff did in a very short amount of time, and you know, everyone involved in this, and you know, kudos to everyone. It's hard sometimes, I think, when we really look at all the things that we have to do as county commissioners, what we do as volunteers in our community, for all the very reasons and the needs out there. Thinking back to my childhood, you know, the oldest is 7 brothers and sisters. My mom babysat. At any one time in our household, there were over 20 kids in our home at any one time. And a lot of those kids had different experiences at home. And later in life, I just kind of reflect back to some of those children and what they were going. I can only imagine what they were going through, and some of which I knew about, you know, but you know, it's just a lot of learned experiences. And sometimes it's people that are abused or have a traumatic experience as a child, obviously grow up. We know they grow up, and maybe a lot of those folks can normalize, but some of them don't. And some of those commit horrific crimes in our society. And we have to remember that prevention in that respect is key. And I think in law enforcement and protecting the public and future generations of kids, because sometimes people grew up in that environment, their children might suffer through the very same thing. So we're talking multi-generational impacts, and we got to get in front of that. And that's why this measure is so important. So despite how we got here, despite what we may feel, or the surprise or the burden or everything else, you know what? We have to step back and just look at the big picture and support this measure and support what we're doing. And I think we all are here for one purpose, and that's to help our constituents to make this a better place. And from the big picture standpoint, I'm just honored and proud to be in the position I am today to move this forward. So I want to thank everyone.
Thank you. And like everyone else, appreciate the efforts of staff to make this happen, and the work of you guys to put this on the ballot. And Martha, by the way, one of my priorities, had I been here another 4 years, would be childcare on campus. You know, we have 2,000 employees here. It'd be great someday to have childcare here. Also, that childcare could be used for taking care of children whose parents are, you know, in the process of being served here at the county or at the Family Justice Center across the street. So hopefully that's something that'll occur in the next 4 years here on campus. It's also just a great thing to offer employees. All businesses of a certain size should consider childcare as a very important tool to help employees do the kind of job they're looking for. So hopefully that'll happen.
Well, Jim, we're going to
go
miss
ahead.
you. We're going to miss you as chair. And I'm aware that that was one of your things. And I think that this, hopefully our new commission, the new makeup will continue to move ahead with that and have that be one of your legacies.
I hope so. I also, I got to thank Ann Leininger, who is a judge now, who brought this issue up years ago. She was a juvenile judge, so she certainly had some experiences, kids with adverse life experiences. Now she is a judge down at our courthouse, which I hope will also be replaced. Another legacy I'd like to see occur. But I think today what we did is that we offered hope. Hope is a very valuable healing tool that children and families have to give them a reason to continue during this challenging time. We all hope that life will return to normal. And I'm sure that children who have experienced adverse childhood experiences hope, and even though they may not even know what it's like to have a normal life. I was lucky. I had a normal life, and I think I did. I may not know. So I plan on supporting this measure too. I would be proud to work for it. And I am optimistic. I'm not a fan of property tax increases, but I'll tell you, I wouldn't have supported the Metro measure on transportation if it was property. I'm not sure I support it as a payroll tax now, but this one is so important that for around $45 for a $300,000 home, you can save a life a year. That's a cheap investment. So with that, let's get to work and make this happen. And thank you all very much. And we are adjourned.